Okay, before I enter patient's room, I'm going to gather all necessary equipment and supplies.
Come in.
Hello, my name is Monique. I am a student nurse from SEC. How are you doing today?
Good.
Good, okay. So I am going to just raise the bed to a proper working height before I continue. Do some hand hygiene. Okay, and if I could just take a look at your ID band to check for identification. What is your name, full name, and date of birth?
Brian Allen Yost, June 22nd, 1980.
Okay, and do you have any allergies, Brian?
No.
Okay, go ahead and put your hand down, thank you. Do you prefer to be called by Brian, or would you rather be called Mr. Rios?
Brian's fine.
Okay, that's good. So then I will call you Brian. So Brian, can you tell me what you're doing here today?
We're just here for a physical assessment
And do you know where you are?
at SEC Hospital,
Okay, and do you know what today's date is?
September 16th, 2020.
Okay, okay, so I asked you those questions because during the physical exam, we like to do a head-to-toe assessment. And what that is I will just evaluate just different body systems to find out where you are today with those. And the questions I asked, those were, you were oriented, alert ×4 to person, place, time, and situation, and that is part of our neurological assessment. I'm gonna go ahead and continue that.
Okay.
But if you could look straight at me, I'm gonna shine a light in your pupils. Okay, and then follow the pin with just your eyes. Perfect. So your pupils were equal, round, they reacted to light and accommodated, which is what we are looking for Perla in your eyes. And if you could just go ahead and open your mouth, I'm gonna just take a look. Notice your gums are nice and pink and moist, not missing any teeth, and your tongue also looks healthy. All right. So, since I touched that, I'm gonna do some more hand hygiene. And then we'll take your vital signs. We'll start with temperature. If you could open your mouth one more time. It's gonna stick this thermometer underneath your tongue. Go ahead and close your mouth and try not to bite on the thermometer. Okay, 98.6, that is good. So since I am a student, I do have to take a 2-step blood pressure. And what that is I'll pump the cuff up once to get just a baseline where your pulse is, and then I'll deflate it. And then I'll pump it up again to get your actual blood pressure. And this is just so to prevent any type of overinflation of the cuff. Okay, go ahead and relax your arm. Right here, please. Okay, just gonna palpate the brachial. Okay, I got 120, so I'll just pump it up 30 above that, which is 150. And as I'm waiting for that, I'll go ahead and move on to checking your heart rate. Just finding your radial artery here. Okay, so for your heart rate, I got 62, and I did that for the first portion of that. And then I went ahead and for the second, I checked your respirations, which is the way your heart rises and falls. And that was at 18, which is normal. I did evaluate your chest symmetry as well as I was looking. It was normal. As you were taking breaths in, didn't look like you were having any trouble. So we'll move on to blood pressure. There you go, perfect. Okay, for blood pressure, I got 118/62, which is normal for your age range. Are you having any shortness of breath or a cough today, Brian?
No,
And how about chest pain?
no,
Any type of body pain at all?
Nope.
Okay, that is good. So, are you passing gas?
yes,
Okay, and when was your last bowel movement?
this morning,
What color was it?
brown,
And what, is that normal for you? That,
yeah,
and
it
the consistency, was it loose, a little bit more solid?
was solid.
And do you have difficulty going? So no constipation issues? How about when you urinate? Do you have any type of urinary issues, type of burning or type of itching, nothing like that? What is the color when you
Yellow,
urinate? And the frequency, how often do you go?
3 to 5 times a day.
Is there any odor?
Yeah, it smells like pee.
So normal for you though, that it doesn't have any other, it doesn't smell abnormal, okay. So then, and clarity, is it clear for you? It's clear, okay. So I asked you all those questions, we're gonna go ahead, and if it's okay, I'm just gonna evaluate your upper half and your arms, just noting, let's see. Looking, no lesions or scars, no edema present in either upper extremity. Arms are nice and not too moist, not too dry. The color is what it should be, and again, no lesions or scars present. Gonna do a Turgor test. Cap refill on each finger. Less than 3 seconds. Turgor is good. And cap refills less than 3 seconds on that hand as well. And then just gonna go ahead and move downward and just keep on evaluating your lower body half. It's okay if I move the covers? Sorry, I should have asked you before I started doing that. Alright, gonna put on some gloves for your lower half. And I'm noticing on your thighs, there's no lesions or anything on your upper legs or lower legs. Skin is dry, but not excessively dry and not moist. No edema present in any lower extremity. Gonna check your pedal pulses. Palpating both of them. Noting equality and strength in both sides. They are both bounding, which is good for that. Cap refill. Less than 3 seconds on that side. And less than 3 seconds on that side. Okay, can you try to push my hands away? And try to push my hands toward you. Good. Okay. And then can you move them in a circle? Okay. Can you bring your left leg upward to your chest and down? And do the same for your right. Did you notice any pain when you were doing that at all?
No.
Okay, that is good. Okay, so I'm just gonna go ahead and also just evaluate some more of your pulse points while I'm down here. We're gonna do the posterior tibial, which is in here, which is good in strength. And if you could just lift up your knees some. Actually, before I do that, let's take these gloves off. Hand Tai Chi. once you're good in strength, go ahead and put your legs down. And if it's okay, I'm just gonna point out where your femoral points are. And they're just right here on the side. And put out your arms. And palpating radial pulses. Both are equal in strength and bounding. Gonna do your brachial, which is good. And then one at a time, your carotid. And carotid pulses are good as well. Okay, so I'm just gonna go ahead and cover you back up here for now. So we already discussed your bowel movements and all that pattern, and there was no pain in your stomach right now? Okay, so just gonna observe your abdomen. If you can go ahead and lift up your shirt. All right, I'm noticing that there's no masses or lesions that I could see from just looking, and no scars. Everything looks good, other than he just has hair present. Now, if you could go ahead and lift it up, I'm gonna have to take a listen to each of the 4 quadrants.
Sure.
Normal active bowel sounds in each of the 4 quadrants, which is good. Just gonna palpate, let me know if you feel any type of tenderness. And as I'm doing this, I'm noting there are no masses, no distension, anything present as well. Any tenderness? Okay, you can go ahead and put down your shirt.
Alright.
Okay, let's do some pushes, pulls, and grips and range of motion on your top half. Go ahead and bring your arms out this way. Go ahead and bring it out this way. Out to the top. Back down. Make some circles. Good. Can you go ahead and push my hands away? Try to grip my fingers. And then try to squeeze my fingers. Okay, pushes, pulls, and grips are equal in both of your upper extremities as well as the ones that were in your lower extremities. So that is good. Now I'm gonna go ahead and listen to your heart sounds.
Alright.
And for this, I'm gonna go underneath your shirt.
Okay.
And for the purpose, I'll just listen to 2 and point out the rest. Is it okay to go underneath your shirt? Okay, aortic, pulmonic, and then the rest on top. We have Erb's point, tricuspid, and mitral. And as I listened to your heart sounds, I heard S1 and S2, lub dub, which are all normal heart sounds, which we want to listen to. Now I'll go ahead and listen to your lungs. Okay, go ahead and take a deep breath in and out. Again. And out. Good. And then I will point out the other ones. So 3, 4, 5, 6, 7, and 8. Okay, so in the front, your lungs sounded clear, and then I'll also have to listen to the back for, I'm looking, the bed is to a height where you could touch the floor with just your feet, so I'm just gonna uncover you if that's okay one more time. And then I'll have you swing your feet that way. Any weakness or dizziness?
No.
Okay. And I'm gonna lift up your shirt again, just to listen to your heart sounds. Or, I'm sorry, your lung sounds. Breathe in and out. Again. Okay, and the other points would be 3, 4, 5, 6, 7, and 8. So it's the supposed to be listening, and this is in the front, 6 to 8, and 8 to 10 spots in the back. And in the back, I also heard clear lung sounds, which is normal. Okay, go ahead and sit all the way back in the bed for me. Just gonna perform some more hand hygiene since I touched my face. Okay. So no weakness or dizziness, Brian?
No.
Okay, I'm checking your environment, no Foley bags, no IV that is present, and everything looks good here. Do you use any assistive devices at home, such as a walker, wheelchair, anything to get around?
No.
And do you need anyone for help for meals purposes or anything like that for bathrooms?
No.
Okay, so that is good. So I'm gonna have you stand up, if that's okay. Bed is lowered.
Alright.
And walk this way for me. And then noticing, I'm looking at him and his back. When I was looking, everything was normal. His gait is normal. Skin in the back was normal, as well as on his posterior ends. Everything was clean, dry, no type of lesions or scars present, or ulcers on his buttock. All right, so I will cover you up here. Give you this call light, and your bed is in the lowest position, and it is locked. Do you have any questions for me, Brian?
No.
Okay, so if you do have any questions, you can use the call light, and if not, I will be back in about an hour to check on you, okay?
Okay.
All right, have a good day.
I think